Mental health is just as important as physical health. We need to treat it with that priority for ourselves as individuals, and we also need to prioritize and fund the support that people need for their mental health, just like we do on the physical side. Mental health is very important to me because I've seen firsthand what happens when people fall through the cracks and don't get the help that they need, and the systemic failures and the enormous consequences for that. My brother struggled with mental health issues. It went undiagnosed and untreated for years while he struggled, and ultimately, unfortunately, we lost my brother to suicide. This is an issue that so many people are facing across the country with losing loved ones unnecessarily. These people who, with the right support, would still be with us today. And when I think about, what's at stake with why so many people are falling through the cracks, Colorado has one of the highest suicide rates in the country for our young people, and it's absolutely heartbreaking to think about what kids are going through because we haven't funded and prioritized these critical services. And so my mom has also struggled with a mental health issues and a substance use disorder. So these are all very personal issues for me, and it's important that we have those experiences represented in Congress. I think I can do better at making sure that I take care of myself and my mental health. This job is, we work all the time, and every second of my day is accounted for. I'm grateful that I have a team that helps me sets boundaries for myself with time that I'm with my family and with my son Davis, and that is what is the most fulfilling thing for me, that gives me the love and support that I need to continue to work as hard as I do every day. So I would say, I try to prioritize that time with my family. I absolutely cherish every minute, but I can also do a better job, like all of us, on reflecting on what I can do to take better care of myself. So I was a state legislator for 10 years, and I'm incredibly proud of the work that I was able to do to draw down dollars for our behavioral health infrastructure, starting the Behavioral Health Administration, actually putting, mental health and substance use disorder care together on what we can do to have that continuum of care investment and coordinated system, those early interventions and support for our kids in schools, and access to free counseling. I think it was 2 a year that we were able to get done, and that's the I Matter program was really important. But while I'm very proud of what I was able to do to draw attention to behavioral health and fund those critical systems, it's still insufficient. And when I see, how we compare to the rest of the nation, we have so much work to do to change that federal funding and actually address the parity laws, and making sure that mental health and substance use disorders are funded at the level of physical health. And it can't be a complaint-based system. This really needs to be the systemic changes to guarantee access and funding. Something that we were successful at the state level that I'm so proud to have been a part of is addressing our workforce shortage around mental health professionals and substance use disorder care. And if people are actually doing those jobs, we had a loan forgiveness program. And I've talked to people directly who have been able to go into those fields that they were interested in because they knew that coming out of it, they'd have the support they need. So very proud of our work there. We have so much to do to support the pipeline. And that is, our loan forgiveness programs for critical need areas. We also need to change the systemic funding piece of this. If we're not funding this, and if we're not addressing the Medicaid barriers, and we're not addressing the parity issues with our private insurers, the federal and state level who are regulating that, you're not going to see the access to care that's necessary. We also need to address the stigma. We need to tell our stories. made myself vulnerable talking about what I've gone through with my mom, my brother, and I felt compelled as a legislator to tell my story, and because of the stigma that exists, and to make sure that people know they're not alone, and that you do matter, and your struggles are not, you're not the only one that's going through that, and we need to make sure that people have the support that they need when they need it. You know, my brother should still be here today, and mental health is just as important as physical health and well-being, and it's important that we have representatives at every level of government who know that.
Now it's your turn. Why is mental health important to you? Post on social media with the hashtag Take5 for Mental Health.